Hello, I'm Abbie and I'm the Education and Operations Manager for Action on Pre-eclampsia. I also suffered severe early onset pre-eclampsia during my first pregnancy. Today I'll tell you about what happens if you are diagnosed with pre-eclampsia. Pregnant women and people diagnosed with pre-eclampsia have more frequent tests to monitor their health and the health of their babies. These tests will be tailored to your specific needs, but generally include more frequent blood pressure and urine checks, and sometimes blood tests. We may also check your baby's heart rate with a special monitoring device and offer ultrasound scans to monitor your baby's well-being and growth. A diagnosis of pre-eclampsia will influence the birth choices available to you. This may mean that the birth plan you had in mind might need to be adjusted. For example, you may need an induction or a cesarean. Having your baby early with pre-eclampsia is not unusual, and sometimes doctors may advise this because pre-eclampsia has caused harm to you or your baby. Your care team would advise on the safest birth options and support you through the decision-making process. After your baby is born, you will be advised to stay in the hospital with your baby until your condition is stable and you're both well enough to go home. Depending on the prematurity and development of your baby, they may need to spend some time in a special care unit referred to as SCBU or NICU. This will be discussed with you prior to delivery though. Your care team will advise you on any follow-up treatment you may need and may give you medication to take at home. Details of your pregnancy should be shared with your GP to ensure an appropriate follow-up is arranged. You will have a postnatal follow-up that may take place either at your GP practice or in the hospital. You may also need to have regular blood pressure checks done at home. Having pre-eclampsia during your pregnancy increases your risk of developing pre-eclampsia in future pregnancies. The likelihood of developing pre-eclampsia again depends on how early you had the disease and how severe. Unfortunately, pre-eclampsia also increases your risk of developing high blood pressure, stroke, and heart disease later in life. This is why it's really important to maintain a healthy lifestyle after birth. Remember, your monitoring, treatment, and the timing of your baby's birth will be tailored to your particular case and will be discussed with you by your care team. Sometimes a lot of information may be provided to you, which can be quite confusing and anxiety-provoking. It can be useful to write a list of questions before your appointment to make sure all your concerns are addressed. Thank you very much for listening to me. Team APEC wishes you a healthy and enjoyable pregnancy experience.